as institution a multidisciplinary global institution and the first institution to implement design thinking curriculum in education. Our institution works based on a holistic 5-group building centers. The 5 pillars are Center for Learning and Teaching, Skill and Career Development, Center for Creativity, Industry Institute Partnership Cell, and Social Responsibility Initiative.
Hi everyone, I am Lavanya, studying first year BPT in SNS College of Physiotherapy. Now I am going to present CLT, Center for Learning and Teaching. I have taken a topic about artificial intelligence and data science in treating polycystic ovary syndrome. Artificial intelligence. Artificial intelligence is demonstrated by machine as opposed to natural intelligence displayed by animals, including humans. Speech recognition, decision making, visual perception. For example, features of human intelligence that artificial intelligence may possess. Artificial intelligence in treating polycystic ovary syndrome. These are the image that explains the normal ovary and polycystic ovary. The normal ovary can be treated as or in ultrasound of ovaries, and polycystic ovary syndrome also be treated with ultrasound, CT scan or MRI scan. Polycystic ovary syndrome. It has epidemiology. PCOS affects 5% to 10% of women of reproductive age, which approximately 4 million individuals are affected by polycystic ovary syndrome. Its prevalence among infertile women is 15% to 20% are common affected by infertile women. It is most common endocrine disorder of women in this age group. This varies the age and it is caused by polycystic ovary syndrome. It is often seen in a student health population and general medical practice, but most often diagnosed when a woman presents with infertility. These are the epidemiology of polycystic ovary syndrome. Polycystic ovary syndrome. It is a common endocrine disorder among females of reproductive age. It causes enlarged ovaries with small cyst. It has global scenario, which is 116 million women are affected by polycystic ovary syndrome. Polycystic ovary syndrome affects 1 in 10 women. First, 10 to 15% are affected, then 50% of women are affected, 13.8 million or billion women are affected with polycystic ovary syndrome. Polycystic ovary syndrome symptoms: trouble conveyance of or infertility, mood changes, ache, fatigue, insulin resistance, high testosterone levels, excessive body and hair growth. Data science. Data science which explains machine learning, researches, Python, data visualization, algorithm, domain knowledge, math, data analysis. Data science means which gives information about the practical knowledge and which explains the artificial intelligence using robotics and machine learning. Data science. Data science which is used in medical field, which is interdisciplinary field that uses scientific method, processes, algorithms and system to extract knowledge and insights from noisy, structured and unstructured data and apply knowledge and actionable insights from data across a broad range of application domains. It gives information about diseases based on informations. Clinical pictures of polycystic ovary syndromes: hyperandrogenism, hyperinsulinemia, obesity, endocrine dysfunction. ovary syndrome. It is one of the heterogeneous disorder of unclear etiology. One of the most common endocrine disorder in reproductive aged women. Diagnosis of exclusion. There are various diagnoses to treat polycystic ovary syndrome. One of or four paths are given here. There are congenital adrenal hyperplasia, Cushing disease, hyperprolactinemia, and which is thyroid disease, which is familiar to us. Pathophysiology of polycystic ovary syndrome. Polycystic ovary syndrome is a condition that originates from or possibility at the time of puberty due to interplay of first one, obesity and excess ovarian androgen production due to hyperinsulinemia, intrauterine environment, genetic factors both X-linked and Y-linked, which is autosomal dominant modes of inheritance, disturbance to hypothalamic pituitary ovarian axis. Symptoms of polycystic ovary syndrome: irregular menses, pelvic pain, multiple small cysts in ovaries are seen. It produces ache, weight gain, heavy bleeding, headaches, infertility, elevated blood pressure, hair growth which is stunned, male pattern, decreased liquid. Surgical treatment. Ovarian wedge resection. It is rarely done in polycystic ovary syndrome. Oophorectomy. It is also rarely done when fertility is not desired and symptoms are severe. Laparoscopic ovarian drilling, laser, electrocautery, multiple biopsy. For example, for domiferin resistance, mechanism unclear, may be due to destruction of androgen producing stroma. These are the surgical treatments which are followed by polycystic ovary syndrome. Medical treatment. Treatment of hirsutism, COCP. Lower androgen level, estrogen component which increases SHBG, GnRH agonist, anti-androgens, for example, spironolactone, cyprothene acetate, flutamide, 5-alpha reductase inhibitor, for example, finasteride. For hair removal, depilation, epilation. Advantages of artificial intelligence. There are several methods to treat artificial intelligence instead of human. There are several advantages in artificial intelligence. Some are as follows. Reduction in human errors, better decision making, increased productivity, improved customer experience. Disadvantages of artificial intelligence. It lacks the data security, bias, both forward and reversed are affected, privacy concerned, costly implementation. To treat polycystic ovary syndrome, a surgical instrument is cost effectively to patients. Thank you guys. Thank you for spending time with me. Thank you so much.